You know, we both trained at Duke, and there's a very famous professor at Duke, and I know you know who I'm talking about. He used to say, what this patient needs is a doctor, and he needs him right now.
Yeah.
Well, of course, that was the doctor saying that.
Well,
there was a doctor
it's a
saying
self-fulfilling
that to the junior
prophecy.
doctors.
That was a doctor
because
teaching.
It was basically a doctor insulting junior doctors that this patient who you just presented to me needs a real doctor.
We need to get better. We need to improve.
Dr. Eugene Stead, who
Yes.
was a very famous chairman of medicine at Duke. But what I think we all know that we need more innovation. You know, this area of digital health. I've been asked many times, what is digital health to you? Digital health is nothing more than focusing on the patient. Whether it's patient source data, whether it's patient in the home, it is focusing on the patient. Pharmaceutical companies now market to patients, but they've traditionally marketed to doctors. Medical device companies still market exclusively to doctors, to hospitals. And the patient, unfortunately, should be the center of those activities. And so I think, to me, the essence of digital health is that we're finally bringing the patient into that circle of the stakeholders and putting them in the middle of it, which is where they should be.
The biggest problem to that concept, right? So I think we are all completely aligned that the patient needs to be at the center. That
I'm not aligned with that even remotely.
Transparency, right? So number one, it's very hard to be a consumer in medicine. Number one, you don't know what you're buying half the time.
Sure, exactly.
Two, you don't know how much it costs.
No, that's correct.
And then you don't know how to interpret it, right? So even if you have all your data, you have all your lab work, you have all your x-rays, you have no clue what you're looking at. And so I think that's one of the challenges for the consumer in today's model, is the idea that there needs to be interpretation and transparency, but I feel like that interpretation.
But I also think that, you know, I think John might agree with me on this, that, you know, we have ways to get that data interpreted through reliable searches and websites and other reliable sources so that I could understand. I can't tell you how many of my friends say, hey, my doctor just did this lab work, I have no idea what it means, and they'll text me their lab work and I interpret it for them. But we could find another way to do that potentially.
I don't think that digital health is a social science. I think that digital health is the empowerment of technology, whether it be nanoparticles or CRISPR or immuno-oncology. That's the magical convergence of science and technology, and that ultimately will serve patients. But if you ladder the endeavor up to the ethereal feature, benefit, value, everything becomes consumer-centric. Cars, restaurants, and it just becomes laddered up into an undifferentiated pablum of I've got my life back. Whether it's an arthritis ad, I've got my life back. CHF, I've got my life back. Schizophrenia, I've got my life back. All of them are the same. They say the same thing. And the pharmaceutical companies all have the same tagline: innovate for life. It's nonsense. I think we should return to the roots of science and the wonder of discovery and recognize that we are here to serve the patient. But we don't have to ascend to this notion of patient centricity. I think it's a big, big mistake. And finally, for anyone who's climbed that ladder.
Big mistake.
Why are we doctors? We're doctors to serve patients. They are at the center of the doctor universe. Why the heck do we even have medicine if all we want to do is play with toys?
The practice of medicine may be a little bit closer to that construct, but I believe the initial premise was digital health, number one, and I expanded that into pharmaceutical.
You just said that digital health had nothing to do with the patient, and you just said that the patient's not the center. Nothing in medicine, whether it's digital, whether it's a stethoscope, whether it's my hands and my breath and my voice, is not patient-centric.
The hotel business is the same way. It all matters about the customer. The restaurant business is the same thing. It all matters. It's undifferentiated, and it becomes laddered up to this top step. If you've ever climbed a ladder, it says something up here. It says danger, warning, do not step here. And I think that's where we're moving into this undifferentiated patient centricity. The magic of digital health, I believe, lives in the application of technology to patients.
Well, I mean, digital health is a phrase that's used for a lot of things.
It's a catch-all.
Principally, it's focused in today's world on things related to that powerful smartphone in your pocket.
That's fair.
And so whether it's using ZocDoc to schedule an appointment, or whether it's interfacing to MyChart into the Epic of your healthcare provider, or whether it's using a LiveCourse ECG device, it is around the ability to acquire, analyze, and communicate information about you that hopefully will improve your health or improve the treatment of your disease. And I think, to me, again, I come back that that wasn't medicine. Medicine was focused, when I trained a long time ago, medicine was focused on the hospital, first of all, and it was focused on treating diseases. And our thought about the patient was, the patient is an example of a disease. And oh, by the way, when the nurse wheeled that patient out the door, it was over. Okay? It was over. Very true. And only when the government said, if that patient comes back within 30 days, it's your nickel now. Did they become concerned about what happened when that door closed on that car? And by the way, that's sad that was it, but that was true. So I think, the smartphone is empowering people. It puts Dr. Google in their pocket anywhere, anytime.
Right.
And I think I am wholeheartedly for it, even though sometimes Dr. Google is totally wrong, completely
Absolutely.
wrong. But we're going to make mistakes. We're going to stumble. But I think our trajectory is correct.
I agree.
And I still see the notion that the patient is the critical factor, and that we lift the veil off the cost conundrum, the master price list, and all these things that we do to hide that 19% of GDP that we're spending. We want to hide it. It's not over here, it's over there. It's third party. Any other business where you've ever heard the term reimbursement? There is no other business where the term is reimbursement. It's usually price, cost, pay, bill.
Why does a hip replacement cost 10 times in New York what it costs in Oklahoma City? Why?
These are all
Same
issues.
procedures, same
and
tools.
I will hope that AI and big data, predictive analytics, will in some measure allow us to address those real issues, which comes down to money.
So this is what I'd love to do. We're running short on time here. I would love to give every panelist 1 minute for final thoughts on AI, big data, and medicine. John, let's start with you.
Let's keep it short and sweet. We have to ask ourselves, is AI man's last great invention? We are going to shift creativity from humanity to a thinking machine. Now, I'm not saying it's going to happen, and I know that you're going to recoil when you hear that, but I think that is an emerging reality that has to be put in some kind of human context.
So I disagree. I think AI is a tool, like any other tool, any number of tools that have come and gone in medicine, whether we talk about the Da Vinci robot, whether we talk about invasive procedures that have now become non-invasive. I think AI is an extraordinary tool. It will be a powerful tool in medicine. It will be one of the many tools we use as doctors and continue to use in our practice to make things evolve and that much better for the patient.
Dr. Albert?
And I think I echo what Geeta says. I consider AI, at least today, and the promise of the future, that it will enable us to improve healthcare, improve access, lower costs, prevent disease. But it's not going to happen tomorrow. This is a process like driverless cars that will take probably decades. But I'm very optimistic that when my children are my age, that they will have AI-enabled healthcare.
Well, I can't thank you guys enough for being here today. This has been a fantastic discussion. John, Geeta, David, it's just been great to have you on the panel. I love the fact that, we've been able to discuss some really difficult issues, and we're actually trying to be fortune tellers. We're trying to predict the future. So on behalf of our panel, we thank all of you for joining us today. We hope you found this Healthcare Analytics News Peer Exchange to be helpful, useful, and informative. We look forward to seeing you again next time.